Going to call the meeting to order at 6 o'clock here. Let's see, agenda review and disposition. Is there anything to add?
No, I don't have anything to add.
Okay. Minutes of August 9th, 2021. Someone like to make a motion to approve the minutes?
Seconded.
Okay, all in favor of that? Aye. Perfect. All right, so, I know there's a lot of people that would like to speak tonight, so I just would ask that you, make your comments brief so that everyone has an opportunity to, speak, and if you could just state your name and the town that you live in, I would appreciate that. Before we move on to privilege of the floor, number 1. So we'll start with in person, and then if someone on Zoom would like to speak, if they could just use the raise hand button, is that an option? Okay,
Yeah.
they could just use their
It is.
little raise hand button.
No, there's a chat option.
There's a chat box, okay. Then if they could just say, I'd like to speak, and then we'll go in the order that's written. So, who would like to go first? So exciting to see so many people here. All right, thanks, Carolyn.
Okay, so my name is Carolyn Dowling. I live here in Plymouth, and I'm a parent of a second grader here at PES and a co-parent of an 8th grader in the middle school. Our kids have returned to school this year after being kept home last year due to a worry about the pandemic. And even though they were home, we were kept up to date with everything you guys were doing. And so I'd like to just thank you for everything that you did all last year and so far this year as well. We were thoroughly impressed with everything that the administration, the teachers, and everyone else involved did to keep our kids and our families and our community safe. So now our kids need to be back in school with their peers this year. And we took comfort in trusting that you would move forward with the same amount of caution and thoughtfulness as you did last year. I've been paying close attention to the mask guidelines that are being recommended by the DHHS and the American Academy of Pediatrics, which are the 2 organizations that you referred to as a source of guidance on masking. There are a few areas of clarity that I'd like to point out tonight, because even with the masks being strongly recommended, it seems that there are still a number of inconsistencies with follow through on this guideline for staff and students alike. The first thing I'd like to point out is there's a map from DHHS with the current level of transmission, and it's listed as substantial. That's the highest rating. DHHS mask recommendations say that when the level of transmission is substantial, masks should be universally required. I brought copies of that map. I'm guessing that you guys have probably already taken a look at them, but I figured if you wanted to, I had them here, or if anybody else wanted to, they're here. Okay. The second thing that's very important to look at is the vaccination rate in town. Currently, the vaccination rate in Plymouth is listed at 46% on one site, and then on the same site under another section, it's listed as 52. Either way, it's not what we were hoping for when the vaccine rollout began, and it gives you a clear picture of the percentage of people who are in danger if the Delta variant does spread through town, and it's already here. We have a small hospital that serves a large population, and I feel that it is our responsibility to make decisions that would best prevent them from being overwhelmed. I'm sorry, I do want to make this brief, but I do also just want to get it all out. Okay, so we have seen and continue to see in areas where the hospitals are full how taxing that can be for the nurses and doctors, but also we have seen how much a hospital full of unvaccinated COVID patients prevents care for everyone else in the community. 4 days ago, Dr. Ebner, who's the chief medical officer at Spear, did a COVID update on Penny Baker TV. It's obviously very kind and informative. He spoke about how the expected surge in New Hampshire has already begun. He informs us that the increase in hospitalizations here at our town's hospital went from about 10 to 20 in July to they're hovering at about 120 to 130 in August. That's due to the Delta variant, and with an increase, a large increase, in children being hospitalized with COVID-19. He states that this is because they are not eligible for the vaccine yet. Masking in order to decrease spread is the only form of protection of these younger kids, including my child, who I'm here to advocate for. It's the only level of protection that they have. The third thing I'd like to point out tonight comes from the other source, which is the Academy of Pediatrics, the American Academy of Pediatrics. Currently, I understand the hesitancy that some have in trusting the CDC or DHHS but I would think that the vast majority of parents do trust their child's pediatrician. And pediatricians all across the country, through this association, state in no uncertain terms that all students older than 2 years old and all school staff should wear face masks at school, unless medical or developmental conditions prohibit it. They go on to list the reasons why, and the first one is being that a significant portion of the student population is not yet eligible for vaccination. That's the vast majority of students who come to the school. They all agree that masking provides protection for these unvaccinated students from COVID-19 and reduces transmission. They have continued concerns for variants that are more easily spread among children, adolescents, and adults. According to these two agencies that you have identified as using for guidance in regards to mask policy, we should absolutely be moving from strongly recommended to required indoors. And there's just one other component that I just really want to briefly touch upon that does not come from DHHS or the AAP. This comes from me and parents like me, my co-parent, our other co-parent here, that involves a deeper level of understanding of the mental health of the students that we're serving, that you guys are serving. You now have back in school many students, like our two children who stayed home last year, who were taught the importance of masking around others and who spent limited time around large groups. Coming back to school is a huge step in a return to normalcy for these students. They feel cautious, nervous, intimidated, and overwhelmed being back around this many people, which is completely understandable, and so many people all over the world are feeling that way as they return to school and work after being isolated for such a long stretch of time. And that, I just want you to imagine that you're that young and that impressionable, and then you're seeing your teachers be unmasked in front of you. You're having those teachers come right up into your personal space with their mouth and nose not covered. Imagine watching the teachers that you're supposed to look up to not enforce or practice the basic safety guidelines that are supposed to be in place and that are strongly recommended. Please put yourself in these students' shoes for a moment so you can grasp the level of intense anxiety that they're dealing with in the beginning of this particular school year. If they do not feel safe, they will not be focusing on learning, and they will lose trust and respect, unfortunately, for the very leaders that they should be looking up to. And I know there are so many opinions on this subject, but the fact is, it really doesn't have anything to do with our opinions on it. It just has to do with the facts, with the science of disease, and the lessons that we can learn from other communities like ours with lower vaccination rates and substantial COVID spread. We know what is safe. You guys know what is safe. There is no opinion that truly matters on it, and if we're following the state's guidelines and the AAP guidelines, it's clear that there's one step that we can all take together to keep each other alive and well. I don't judge others who cannot be vaccinated or will not be vaccinated. I give them care and compassion by masking indoors in public spaces. I ask that you care for my child and family the same way that I care for your child and your family. I ask that you do this until every child at Plymouth Elementary School has had the opportunity to be vaccinated. Thank you.
Thank you. Yes, Gina.
So my name is Jenny Tebow, and I live here in Plymouth. I'm the parent of a third grader and a first grader. I had a conversation with our kids before they went back to school, talking about why we mask, why we've been masking, why when we go to Walmart, we're masking, other people aren't. And I said it just comes down to us respecting ourselves and other people. When you go to Spear, there is a sign that says, in front of, I believe, every entrance, safety and respect for all. That's why we wear the mask, safety and respect. I know that it's a difficult topic, but like others, I feel that it just comes down to the safety. Businesses in New Hampshire and Plymouth are starting to, ones that had backed off the mask requirement, are starting to re-require it. There are people who come to our elementary school whose health is compromised, and other people not wearing masks increases that compromisation. And it does come down to it. The elementary school kids can't be vaccinated yet. I know that when it was all happening this spring, we were like, oh, maybe they can do it by August, and clearly it couldn't happen. But even when it does happen, the masks, I mean, it's, the other two things that I just want to point out is that if you look at the reason for why we mask, it reduces the intensity of the infection and sickness, and it reduces the spread, which are the two things we care about. As someone who works in a sort of retail environment, which has a sign that says, vaccinated people do not need to wear masks. If you are not vaccinated, please continue to wear masks. And I had someone who came in today who said, when I asked for his ID, he said, oh, you want to see my vaccination card? Well, I don't have one. And it's like, but you also don't have a mask. So it's not like people are following the rules, which would it require us or allow us to lax on those requirements. So I just feel like it is something that the school should do, not because we have to, although we did get our first email today about Plymouth Elementary School, so obviously it's happening. We've got other schools in the SAU, there's been at least 2 other schools plus Plymouth where we have gotten emails. It's here, it's not like it's not here. The masks help, and I feel like that should be the guideline, and the Plymouth Elementary School should change their rule to require it. Thank you.
Thank you. Yes.
My name is Martha Fabertus. My son is an 8th grader here at PES. I also have an 11th grader at the high school. I have some remarks prepared, but both of you have spoken very eloquently to many of the points that I was going to make. So I just want to point out a couple of things that haven't been mentioned before so far this evening. First of all, like others have said, I do want to echo that, last year my son, we homeschooled for the first 2 trimesters because he was very anxious about coming back to school during the pandemic, and we did not feel he could learn when he was that anxious. By the end of the year, towards the 3rd trimester, we had been watching what was going on at the school, and we had a lot of confidence in how this school was handling COVID, and so we felt comfortable sending him back. And in large part, that was because of the mask requirement and because we had heard from people that it was being followed so diligently at Plymouth. And he had a really successful final trimester, and we're so glad that he was able to come back to school and experience a little bit of normalcy in 7th grade. And we're very, very lucky that he's old enough that he was able to get the vaccine. But I feel so strongly for my fellow parents whose children have not been able to have that opportunity yet. And it disappoints me to see us not doing more to care for those children this year the way that we cared for all children last year. So as this school year loomed, I was really worried and wondering what the SAU was going to be doing, particularly as Delta was raging towards the end of the summer, and we were seeing really frightening reports out of some states down south. And there were 2 things about this year's plan that dismayed me. And the first of which is that there's no mention of our SAU making use of or planning to make use of the Safer at School screening program, which the state of New Hampshire has made available to all school administrative units, paid for through a federal grant. And what it allows for is testing of asymptomatic, voluntary testing of unvaccinated asymptomatic individuals once a month, again, at the state's expense. It doesn't require or mandate testing, and it's not a substitute for testing for those who are symptomatic and who still have to go through obtaining a PCR negative in order to rule out negative COVID-19. And given, as others have said, our vaccination rates in Plymouth aren't great, I looked at the dashboard today, and I'm a little bit hesitant. I don't know how reliable this data is, but right now, as of today, it's saying that among 12 to 19-year-olds in Plymouth, we're only at a 14% vaccination rate, which is incredibly low, and that's among the students in our middle school. That includes the students in our middle school who are eligible for vaccination. So the fact that most of our students here at PES are under 12, I think having that the SAS program in place and available is one step towards us understanding and controlling the spread of COVID in our school community. From doing some of my own research, I know that this kind of surveillance testing actually isn't as effective in localities that are not experiencing substantial spread, and it's a little difficult for me to speak to whether or not our numbers right now constitute substantial for this kind of a testing program. I would leave that to the epidemiologists. So while I'm aware we might not be at that threshold at this point, we can implement SAS at any point during the year. So, and I would also say that I'm a PSU employee where I was a part of regular weekly and then bi-weekly testing at the university all of last year. So I know firsthand that in a very short amount of time, we can go from minimal spread to substantial cases. We went from single-digit cases to 104 cases in a single day overnight at Plymouth State University, and that led to a huge surge that drove cases up in the county and in Plymouth, the town of Plymouth. So I strongly encourage the board to take advantage of the SAS program and put a plan in place to immediately implement it when we see those numbers rise above whatever threshold makes sense. And I recommend determining what that threshold is and clearly communicating that to the parents at Plymouth Elementary and to our community at large. I see absolutely no reason not to be making use of testing that the state is willing to provide to us free of charge in order to ensure that our community is as safe as possible. The second piece of the plan that others have spoken to tonight that I found very discouraging was the masking policy and how it is ranges from optional to strongly recommended in the guidelines, and that there is no guideline or threshold at which it would become required other than saying that only local school boards can make that determination. Published guidelines for the start of this year stated masks were recommended when individuals could maintain 6 feet or more of distance. As of this week, that has been reduced to 3 feet of distance. And I just want to point out that this is less protection than we had last week. I don't understand this because case numbers have gone up in Plymouth, have gone up in Grafton, have gone up in New Hampshire, and I was not aware that we now have a positive case in this school. I guess I haven't gotten that email yet. So there have been numerous studies about the efficacy of masks. It's actually really, really hard to study this matter. And the reason is that when we look at real world usage of masks, there's all kinds of confounding factors, like the types of masks people use, how well they fit, how vigilant people are about using them, what the impact of environments where some people are masked and others aren't, and the interplay between masking and social distancing and other public health policies and measures. On the other hand, you have lab studies that look at masks, which often present ideal circumstances that look nothing like the real world that we live in. So it's very difficult to discern the actual impact of masks in our schools and classrooms. But I believe that in the absence of clear negative impact of masks, and in the presence of data that suggests masks are indeed beneficial, it absolutely makes sense to require them. And there is absolutely evidence masks work. You know, we've been using them since the early to mid 20th century by medical professionals in healthcare settings. In countries prior to this pandemic, mask wearing was common due to pollution and during certain flu seasons and other seasons of illness. And studies have already shown that they provided protection against the spread of disease. Meanwhile, just during COVID, and this is relevant to those of us who care about this in a school setting, several studies have shown a correlation, at least, between mask wearing in schools and lower rates of spread of the virus. As another parent has already mentioned, the AAP recommends mask wearing over 2 years of age in all school settings. At PSU, we began the semester with a 2-week requirement for masking that has now been increased to October 1st because we recognize that this is a public health measure we need to take to keep our campus and our community safe. But the most important precedent is our own. So last year, SAU 48 and PES mandated masks. And by your own reports and our own experiences, we did a good job of controlling this disease in our community. Why are we going to ignore that experience, throw it out the window, and do something different this year? And I will just say there are no reputable studies showing that masks are detrimental to health. I won't go into that in great detail, but the only way I know to deal with this pandemic is to educate myself. I've spent so much time looking at these studies. I have not found a single one that absolutely shows, or even kind of shows, that there is truly a detrimental effect to our health by wearing masks. Last year, the SAU was able to offer students an in-person experience while students, faculty, and staff remained masks, and I would argue they were able to do this successfully because of the masking requirement. Removing it this year as students under 12 remain unvaccinated and Delta surges around the country and into our state seems to be ignoring all of the evidence at our disposal and lessons from our past success. The state of New Hampshire has clearly left the management of local COVID responses to you, the local SAU leadership, and this is a tremendous responsibility. I am sure it is not one that you take lightly, but there is nothing preventing you from requiring masks. Your own guidelines don't have a threshold which must be considered before making this change, or planning for and implementing the SAS testing program. One of the core beliefs stated at the top of this year's school guidelines is student, staff, and community safety will be our highest priority guiding every decision. It's actually the top belief at the top of that document. At face value, this statement gives me great hope, and I'm here to ask you tonight, how does making masks optional, refusing state-provided testing, protect and prioritize the safety and health of students, staff, and our community? Thank you.
Thank you. Is there anyone on Zoom?
No.
Okay. Do you want to say something, Steph? Yeah, of course.
My name's Stephanie Halter. I am a proud mom of a fifth grader here. She's 10 years old. She is, like all 10-year-olds in your school, unvaccinated as well. And I just want to thank you guys for doing such a good job last year. I was skeptical at the beginning of the year that we'd be able to pull off being in school. And we did such a great job, and my kid felt really safe. Unfortunately, I don't know that she feels totally safe right now, and I definitely don't feel like my kid's safe in school right now. She does report to me that probably 3 kids in her classroom continuously wear masks right now. And when they get up and move around the room, that goes up to about 50%. And I think that's pretty poor. And the desks are really only 3 feet apart, right? So she's very close. So leaving it to the families, leaving it to the kids to have a choice. I don't think that they're following, maybe their kids aren't following what their parents really want. Maybe a lot of people don't really care about the mask. Maybe they don't care about their kids. I don't know. But I care about mine. And I care about all of the other kids I know in my community that are unvaccinated. And I would really feel a lot safer with my kid in school on a daily basis if masks were required by all kids, right? And not just recommended. I was really dismayed to find out that the vaccination rate in Plymouth is 45% as well. And I think with a vaccination rate that low, we have to expect that there's going to be a lot of exposure this year. So to waver on the mask requirement at this point is not wise. We've done pretty well. Our kids have done really well. Not only education-wise, because they've had great relationships with their teachers. They've really thrived at a time when so many kids in our country haven't thrived. And I really am grateful for that. I am nervous about this year, as I think a lot of parents are, with this new Delta variant. And I think we have to really think about the science on that. And what I have seen from the CDC is that it definitely is more infectious and it is more transmissible, right? So that means that more people are going to get it. And when they get it, they're going to get sicker. And that could have a greater impact on kids. And I think we have seen that with more kids getting this illness than before. And while we haven't seen a lot of kids die, I don't know that I want to see my kid get COVID either, though, right? There's some long-term health effects of this illness that we still don't fully understand, okay? And I have a kid at the university last year, one of my young adults who got COVID, got heart inflammation, and she'll be taking heart medication for the rest of her life. I don't want that for my kid. And it's great she's not gonna die, but what quality of life is she gonna have? And it's up to us to provide a safe environment for our kids. If we do one thing, let's do that well. It's not safe right now, right? And I know you're in a tough place. Politics aside, it's rough to be asked at this moment to stand up and do the right thing, to lead for our kids and keep them safe in this environment. Politically, it's rough. But I do think it's your responsibility to do this. So in some, I'm a scientist, I might be a social scientist, but I do believe in science. I think it's under our imperative to follow what science says, right? And there's so much that is out there glaring at us right now that is saying that we need to be taking more steps to keep our kids safe. And a mask isn't that hard. And I'm happy to show up at these meetings every month if we need to. I think the people in your community have your back. We just need you to make the right decision, make masks mandatory. And consider the testing. I think that's always great. If it's free, we should do it.
Thank you.
There is one chat.
Okay.
Oh. I'm going. Oh, he can, you want to have
You
him
want to
speak?
speak? Yeah, please.
Tom, are you able to speak?
All right.
Oh, is he unmuted?
No, I'm trying. Hi, Tom, can you hear us?
Can you just take the chat down? There we go. Can he get,
You unmute him on the right in the list.
Yeah.
He is
He should.
unmuted.
Tom, I think you're muted on your, oh,
The microphone isn't working.
We could, if we could read his comments since he took the time to type them out.
Tom, we'll read your comments out loud since we can't hear you.
Thomas McEwen.
Oh, jeepers. Sorry. All right, so students are at 0% risk from COVID if masks work, wear one. The CDC has stated vaccinated are super spreaders and transmit the virus. I have 32 studies that masks are ineffective. You people are so
Disingenuous.
disingenuous.
Yesterday.
Yesterday, through
OIA.
OIA, it was proven Fauci made this virus, and you are taking advice from him. If you want to wear a mask, wear one. If the vaccines work, take one. The vaccine is not approved by the FDA. It is still under EUA status. I will never wear a mask ever. Thank you. Unmuted. Sorry, tried to unmute you.
Okay, thank you.
Tom McEwen?
And is he a Plymouth resident?
Yes.
Yes. And Karen.
And a parent? Okay,
Yep.
just for me.
All right. Thank you. We're going to move on to the principal's report.
Okay.
Is there anything else on there?
Pfizer is FDA approved.
Yeah.
So we have to be careful with the chat. to not go back and forth.
Sorry.
All right, we're going
That
to
can
move
go
on
on.
to the principal's report. Thank you.
So I wanted to let everyone know, I've got a number of things. Our total enrollment as of today is 392, which is down about 30 students from last year. That's in part due to the fact that we graduated a rather large class and we had a number of people move out over the summer. At this point, our K-1 dual grade classroom, which is a new classroom set up at Plymouth, is going very well, and I'd like to personally thank Kim King for taking on that challenge, because teaching in a dual grade classroom is a new endeavor. Want to let everyone know about our our theme for the month. So our theme is belonging, and we're working hard in our classrooms to understand what it takes to create a sense of belonging for our fellow classmates, and to think about what we belong to. What does it mean to belong to the Plymouth Elementary School community? Under the area of curriculum instruction and assessment, I want to let you know we are in our second year of implementation with our new math series, and we're working very hard to get started in that program a little bit earlier with more fidelity in the year than we did last year. We are also going back to teaching handwriting, which had not been a focus for a number of years, and we're using the Handwriting Without Tears program to do that. We are not starting with cursive because we've decided that some of our intermediate students need to learn how to print well before they learn cursive. Under the area of social and emotional and behavioral supports, our student support team is up and running and we're meeting weekly. And I wanted to let the parental community know that we are implementing the DESA universal screening this year, and information about that will be coming home via email. Sorry. What the DESA is it's a universal screening that looks at social emotional competencies, 8 competencies, and then we identify students or classrooms that need specific skill development in those areas. So we're excited to be doing that. I want to shout out to the 8th graders. On the opening day, they had a curveball thrown at them by me, and we worked, we broke the 7th and 8th graders, actually both groups, down into multi-age groups, and we met outside and we talked about values and Plymouth Elementary School and got their input into which values they feel are most important for Plymouth Elementary School. And we're working to have a follow-up survey for that and then to engage them in creating a values statement and visual for this building. We will also engage the parents and the staff in that as well, but I'm actually starting with the students, and I think their voice needs to drive that discussion. Shout out to the teachers and staff. I think that they have done an unbelievable job entering the 3rd year of work for them, of taking on the challenge of the pandemic and the kids here. And we have an amazing group of adults in this building, and I could name them all, but I'm going to name them in group tonight. I'd like to thank Abby Batchelder. She organized the PTA book fair, and it was fantastic. It was right here. And I'd also like to thank the entire PTA for the cake at the open house. It was we were creative and engaging our families, and that was a success. So thank you to the PTA and Abby in particular. Want to let you know that in the area of food service, Tracy Sawyer has been our site lead. She's given her notice to Cafe Services, and she is working to train our new site leader in the coming weeks. Our new Chromebooks have come in for our kindergartners, and they'll be up and running in the next couple of weeks. And under recent and current events, I want to let you know that our professional development before school went very well. We had Polly Baffin, a consultant, to work with us on setting some of our values, exploring our values, and looking at our behavioral supports and instruction, and then a discipline program that aligns all 3 of those, which is already exciting for us. We also followed up last year, the board and the PEA agreed upon the Danielson model for the teacher evaluation system, and we had a full day training from Danielson, and it was extremely well done. It was some of the best PD, I think, that I've seen. We had our primary wing open house on the 26th, and our first day of school was August 30th. It was fantastic. Some of you may have noticed a couple days later, we had a flailing arm man outside. We were putting our hands in the air that we were back in person. For upcoming events, the 8th grade is scheduled to go on the overnight to Franconia Notch, leaving tomorrow morning. Looks like it's going to be a very rainy trip, so wear your raincoats. And Friday here at the building, we'll be having a remembrance of the 20th anniversary of 9/11 during PES News. Next week, the 7th graders will go on their Geneva Point field trip overnight on Thursday and Friday. On September 22nd, we have a visiting author coming, Chris Van Duzen. And on September 29th, we will welcome back Rachel's Challenge, which is an organization out of Colorado that addresses the root causes of school violence, bullying, prejudice, and self-harm through social emotional learning. Comes right out of the Columbine shooting event. And that's enough. So that is my update. And Kelly will give you some sports highlights and safety.
Welcome everybody, good evening. A couple of quick things on the athletics front. Fall sports are all up and running. We have an official total of 136 athletes that are out there involved on our teams, so that's good to see. Just a couple of quick things. Fifth and sixth grade soccer opened up last week in a game against Waterville Valley. They lost that opening game, but I will say we were very excited for Waterville, and they are having their first team ever. So
Any sport.
any sport. So
Well,
they're-
besides skiing.
they were excited to play, we were excited to host it, so it was a good day. And then the kids were on the road today over to Holding Central, and I think came back with a win. Football opened up their season today. They are probably on their way back from Kennett right now. Great numbers there too, with 28 players on the team. Field hockey was out back here today hosting Campton for their opener, and cross country headed to Belmont this afternoon as well. We've got 7th and 8th grade soccer teams and volleyball that will begin their games next week. Volleyball opens up at Interlakes on Monday, and soccer heads to Kennett on Tuesday. A couple of other things, we did hold our sports physicals here today with the help of Plymouth Pediatrics. For those students needing an updated physical, we had, I think, 18 students take part in that. And then our sport team photos will be held next week on Monday and Tuesday, and all the ordering information is posted on the athletic portion of the website, and hard copies went home with the kids today. In terms of our safety committee, we did meet last week, September 1st. Committee members will be helping to assist any of our new Plymouth Elementary hires with safety drills and expectations. Our first fire drill dates were set and will begin this month. And we also set the date for our fall bus evacuation, which will be held next week on September 15th. And lastly, our faculty and staff had the opportunity to install the InformaCast alert app on their smartphones and laptops last week. Many thanks to John Ramsey and Carol Lavassa, who helped everyone in that process. Faculty and staff who missed the opportunity can see John at any time to help with that. And then Joe Bonin and Plymouth PD will run a trial test for us with the faculty at our faculty meeting next week. That's it.
Perfect, thank you. All right, we're gonna turn it over to
Oh,
Kyla.
thank you. If you can read, we have an open letter from, we've been working with Dr. Ebner and Britt McDonald from Spear, so if you don't mind reading that letter that they wrote.
Yes, of course.
That would be great.
Of course. We are writing this letter today in support of the administration of SAU 48. As healthcare providers in your community hospital, we have a vested interest in keeping levels of COVID low in our community. We worked through the original COVID outbreak, and we have continued to work and help prepare for the Delta wave of COVID. There are many competing guidelines as to how to prevent COVID transmission in schools. Throughout this pandemic, SAU 48 and Spear Memorial Hospital have relied on the wisdom and leadership of the local organization, New Hampshire DHHS. DHHS helped Spear set up an emergency COVID unit at PSU Ice Rink. DHHS has at least weekly Zoom calls with New Hampshire hospitals, school nurses, and SAUs. They have led us through the pandemic with insight and knowledge as to the situation our state faces in this pandemic. We feel that we should continue to follow the guidelines of our local health department. As healthcare providers, we regularly review both CDC's recommendations and NHDHS. We acknowledge CDC's recommendations are more aggressive. We feel that following the organization that is specific to our region and our circumstances is appropriate. We also believe that both the administration of SAU 48 and DHHS will change the recommendations for masking and testing should the circumstances of the schools in the SAU change. Lastly, as parents in this community, we appreciate the continued work of teachers and administrators in both keeping schools open and keeping our children safe. Sincerely, Britt McDonald, Chief of Medicine, and Joseph Ebner, Chief Medical Officer, both of Spear.
So typically I do a regular COVID-19 update from month to month. And there are a couple new pieces in place, which thankfully gave me the flexibility to move in one way or the other in June when you approved your new plan, the continuity of services. We had long discussions about masking and whether or not we should go optional to recommendations. The board chose to do recommendations and have it be a parent choice. and then look at the matrix from DHHS, which we do use the graphs on the DHHS website, and drill down by each town regarding vaccination rates. And I know the community is at substantial spread, but one of the pieces that we have talked about is our local communities, as well as our in-building cases and spread, which is something we've talked with Dr. Chan quite a bit about. There are many superintendents that are not medical experts that need that guidance pretty quickly, just because the questions we are asked are thresholds and numbers and that piece, in which they're very clear that there is no set number. It's about the cases. Okay, if we have, like I have a number of cases at Campton, but they're all from the same family, so do you treat that as the same as third graders in the third grade, and then do you target those mitigation strategies separately? So you have layered mitigation strategies here. One, which is the controversial topic, is if you mandate or not mandate masks. I mean, it's not just local, it's not just in Plymouth that we're having this conversation, it's nationwide. The other piece is we've updated all our ventilation systems and make sure the airflow, I don't have all the numbers on me that John Francis has given you before, but I know they are adequate, if not exceed what the minimum guidelines are around that piece. The other piece is we did go back to self-screening. That has been very helpful in the schools. We have been able, and then we are requiring testing. So initially the DHHS really wasn't requiring testing. They were saying go back to your regular sick policy. We put our original COVID response to symptomatic individuals back to testing, or you have to stay out the 10 days. Spear has been great about helping us with the testing, as well as other local areas, as well as mid-state as well for the antigen testing. Other pieces we've looked at is spacing at a minimum of 3, preferred 6. Some get lost in the weeds of the distancing pieces. If I were to write my press release from last week, I would have done it very differently. I didn't mean to be as confusing as I was. There's a lot of numbers, 6 feet, 15 minutes for 6, so I apologize for that in advance. We shifted to the 3 feet because that aligns with the guidance from the Department of Health. Not really, I know that it was increased, but it better aligns with, yes, it's feasible at a minimum to be 3 feet, but our goal is really 3 to 6 feet. But it's, we're measuring furniture in the classrooms, but with kids, it's just it's a guideline to go by as far as that. We did shift from optional masks. We made a recommendation right before school started to go to recommended masks when you can't physically distance, which generally is hallways, common areas, up and moving. Most of our desks and are spaced right in at least 3, if not more. So that it's a layered approach. Washing your hands, I think that's something that's been in place too. We have met with the teachers union many times and been on board with them, which has been great. We have a great working relationship with them. Like I said, Dr. Ebner and Britt have been super helpful with any local resources as far as testing. So we're meeting with them weekly as well. And we're on the phone with the Department of Health almost every day. Looking at whether it's the data, the vaccine data. The vaccine data on that dashboard is kind of accurate. It says Holderness is 100% 12 to 19-year-olds, which I know is not true. So it's just, there's a couple different sources you could pull the data. How you want the school dashboard for the Department of Health is not accurate ever. So we have our own we did put in place our dashboard again. Many districts are not doing that anymore, but it seems like our families unless I hear otherwise, that to get the press releases, even if they're not in our district, so they know what's going on. There are districts and SAUs in our local area that are not communicating that out anymore. So the other piece we put back in right before school started was we are identifying close contacts. That's something we weren't going to do with the initial guidance, but given the Delta variant, it's important that we follow the DHHS guidelines that, if you are a close contact, you're identified as that. We cannot ask vaccination status. That is something that it's a law that was passed it's specific to New Hampshire. But we did have vaccination clinics that we made available in the spring for teachers and staff. So our teachers and staff, I would say over 90% of our SAU staff have been vaccinated. And then as far as kids, I don't know, because the 16 and over started a little bit earlier than we were able to offer it. I asked about the booster shots. It's more so for our faculty and staff right now. If we could have a clinic, but there are vaccines available. The answer I'm given, there's vaccines available everywhere in your local pharmacies. You can just get it when it becomes available. So that's what it will be. That's my update. You have one case that was reported out late this afternoon that I received notice about. It is isolated at this point. So we do talk to DHHS. They tell us if we have a cluster. They tell us if we should move mitigation strategies. We have to list our mitigation strategies to them every time we give them a call. So if you look at area districts, the masking issue is pretty split. I would say right now for Lakes Region, I'm part of a Lakes Region superintendent's group. About 10 districts are masks recommended and about 4 that are required. And it's only indoors, it's not outdoors. So 4 or 5.
So can I ask a
But they're changing, I can't keep up with that data. So that's the difference from last year to this year. We had the backing of a mask mandate from the state and from the Department of Ed. That is no longer there. They really have been clear about that's a local decision, unfortunately, on the school board to make, if you want to exceed that and require them. If you don't. The testing piece that we were talking about, that is something that's available. If you would like me to explore that more, I can certainly do so.
In terms of current policy, is it fair to summarize that the only thing that we're doing differently now is that we're not requiring masks?
Yeah, we didn't do the testing last year.
I'm thinking between what we're doing now and what we did last year, is it simply the mask optional policy? It sounds like we're back to contact tracing.
I think we were much closer to 6 feet. We've moved back into the classroom.
That changed, the 6 to 3 was changed late spring, even I forgot about that piece. I mean, it was just, there's no exact, I don't want to get caught on exacts because even when we talk to DHHS, they're like, it's preferred 3, if you can get to 6, do that. I mean, it's just a range of, keep your either 1 arm's length or 2 arm's lengths is how we talk to elementary school kids. And when you're up and moving around in common areas, it's suggested. So that's what we're recommending right now, given some of the outside data. We don't have in-school transmissions, so, but there will be more cases. I mean, there will be. It's the nature of what happened last year too.
I would be interested to see about the state testing. I would like to see how it would, if that was to happen at the elementary school, what sort of, not a disruption, but it would be a disruption from the students regular every day. So is it something that, how would it work? What would it look like? So I would be interested in.
So there's a couple different options in regards to that. You can contract out with someone to do, to test symptomatic students. We have talked with SPEAR. That is a lot to put. I don't think we can add that to the plate of our nurses at this point to be testing. And we have available tests everywhere and available for symptomatic students. There is another strategy of doing pool testing. So, for lack of a better term, it's spit testing. They send out the group if one comes back positive, more to look at the prevalence of COVID in your building, in your community. That is another option, or to look at different groups like sports teams. It's different with minors. It's all obviously not adults.
Anonymized.
I did check with the other SAUs in our area. The only one that is looking at it right now is Winnisquam. About 15% of families are taking advantage of PCR testing, which is not through the SAS program. They're doing something else on their own. Concord is doing this hybrid approach. And they're seeing what's what. You can sign up for it. It's something that you can sign up for too, and then take advantage of it if you need it down the road. So if cases really go up and we need to take advantage of it,
Okay.
so it's just different options.
Okay. Okay. Thank you. Do you have any other questions?
Well, just a couple of comments on testing. So symptomatic testing is resource intensive, right?
Mm-hmm.
If someone is symptom, you should be gowned up and all that stuff. So that's a whole nother level of supplies. It's also exhausting for the tester. Asymptomatic testing is fraught with challenges. Any test in medicine is more likely to give you good information when you think the person actually has the disease versus when you just do a bunch of tests on everybody. And so I'm always a little leery of some of those things, just food for thought. I'm not arguing one way or another, but
Well, that's why I asked the
something to think
question.
about.
So I appreciate the comment, like, thank you. All right. Frank, do you have anything to add?
I have a question about the Safer at School program. Do you know, I'm on the website right now looking at it. Do you know how it's implemented? Do they provide testers?
So
or
they do provide testers.
Testers.
There's some districts where some nurses, so many schools are doing different things, but they do provide folks to come in. I believe I'm speaking correctly on that one. Yeah.
Okay.
So that would be more of a beneficial where you are in an area that you don't necessarily have as many options for testing. Is that correct?
Asymptomatic.
These are asymptomatic.
It's just to, to
Okay.
see the, but if you only have 15% sign up, I'm not really sure of the purpose, but I don't know.
Yeah.
I don't know, yeah.
Okay. All right. I guess we could do some more research into,
Well, I have it if you're, if you're
Yeah.
interested in looking at it. It really has been, some boards don't want to get into that arena, some want to research it, so it's really up to you if you want to move forward with me looking at any of it. I have talked with Dr. Ebner a bunch on testing. He's happy to, just at this point, I don't think he's recommending it, but.
Random testing would be a level of protection, but I also think that we underestimate the level of caring that each family has for their own children's well-being. And I think that this community's done a great job of recognizing that my individual child is not feeling well and taking appropriate precautions. I don't think we haven't seen any evidence of community spread in the school. While screening would be additional information, I wonder if it would be actionable in any way.
how do you randomly screen who you pick? That seems to me like it causes a whole set of challenges in terms of who gets tested and who doesn't, if we're going to try to do some sort of random asymptomatic testing.
Right.
I don't know, I think that would be tough to implement.
okay.
It also says that the testing results will only be shared in an aggregated form. I'm not sure exactly what that
individual.
means, so it won't be individual.
So it's the pool testing, so if they're all negative,
That's what
and
I'm
if one
reading.
positive
Yeah,
comes
I'm
back, my
reading over
assumption
this
is
very
they
quickly,
they
but-
test every individual with PCR, which usually happens.
Okay.
So I guess it's more for trending.
Sure, but
Spread.
there certainly impacts on those kids that are pulled out of class to get tested.
Right.
I mean, what does that do
Exactly.
to that child, right? I don't know.
That's the other thing. I was
Hey,
thinking.
come get your COVID test.
It's not normal.
I think that's the big question with a lot of this is we don't know. We
Right.
don't know what the ultimate
What's right,
impact is
what's not.
with the disease and.
Yeah.
It's not.
Okay. All right. Thank you, Kyla, for the update.
So if you want me to explore that more, just let me know at the next board meeting or whatever.
Okay, thank you. Go on to reporting child abuse or neglect policy.
Yeah, so you don't have to do much with the next two reports. There is, all of the paras and many of our staff have been trained in the know and tell of when to report to the Department of Health, DCYF, I'm sorry, I'm using Department of Health so much. Abuse and neglect, obviously, we're all mandated reporters, so it's a little bit more specific. in regards to that piece. So it is a policy, it is a required policy. We are behind on policies because of COVID, so I'm introducing some new policies. You typically either read them once or twice. You don't have to vote on anything tonight, but it is the New Hampshire School Board's template if you wanted to move forward with that, or if you want another month to take a look at it.
Okay.
It's up to you. Usually do a couple readings, we can come back and you can approve it in October, is usually 2 or 3 readings.
I would move that we look at this in November.
November? October?
October.
We'll do a second reading in October. Same with the student discipline policy. This is a law that was put into place. We are behind on that policy. Again, I ask you to take a look at it because it will suggest changes to your handbook. But again, it's all required by law. Everything in there is just the law, not anything in addition to. So it is around suspension, students with disabilities, when there's a manifest determination, if there is a student with disabilities that exceeds the number of days that they can be suspended. So it just looks at more prevention, which is good. And then, what the level is after there's discipline in this building, and then if they have to come to the SAU, it more pertains to the high school sometimes if there's a major incident.
Kyla, where did this policy come from?
New Hampshire School Boards Association.
Okay.
And it is in response to a law. And just a heads up on other policies, I think there's 36 new required policies based on what happened in the legislature last year. So I will try to not overwhelm you with many of them, but some of them are little changes, some of them we have to look into 5 or 6 other policies to straighten it out. So I will streamline that as much as possible for you. So if you just want to take a look at those, the administration will look at that to see how they, how that impacts their handbook, because it definitely implements or affects that piece as well. So you don't have to act on any of that tonight.
Okay.
These are new that never existed policies.
You have student discipline policies, but they're now not in alignment with the new law.
Okay, so
So
they're old policies.
this, yeah, and typically, our school boards, I don't require that you exceed or anything. It's just, here's how you follow it, and if you want to Plymouth-size it, or whatever you want to do, you can do so as well. But there's so many of them that we just try to keep it to what's required, and that's it.
Okay. All right. Thank you. So we're gonna move on that one next month too?
Yeah,
Okay.
propose to
Yep.
table them until our October.
All right. All right. Is there any other business?
The only other piece is I sent around the MS-25s, which are your financial reports. I will review with you in October the details of what you had for unexpended fund balance, revenues, and other pieces that go into the financial report. So that will be on your October agenda.
Do you know offhand the equivalent state aid we get per pupil from, do you know roughly what that number is?
For Plymouth?
Yeah. Well, what the per pupil state aid is?
You mean in regards to like the education freedom accounts?
Yeah. Yes.
So, so school choice was put into place this past year, so how would it affect us? The state has not figured out. So it's not that so say if somebody from Plymouth wanted to go to Waterville, let's say, they deal right with the Department of Education. They have to put in their financial status as well, and if they exceed that, they don't qualify for it. So there's some contingencies to it.
I think it's 300%.
They can get up to, I would say, and now this is just a guess because I don't have a number, around 5,000.
That was, yeah. that
But
was-
it's all managed through the Children's Charitable Trust from the Department of Ed. So we have nothing to do with the transaction.
Right. No,
But it just depends.
I just didn't know if that number came up in our financial anywhere. offhand.
Not yet, no.
Not yet.
And then,
I did a quick screen through it,
yeah.
didn't find it anyway.
Yeah.
Two.
Okay.
Okay. Everybody sign this? Did we Mike sign this?
I didn't.
Okay.
Yeah, claims and payroll went around, and then the MS-25s, Amy, you had to sign in a specific spot for that.
Got it.
Got it.
Thank you.
You're welcome.
All right. Recognition and rewards. What's that for?
Oh, just,
Real?
oh, it was the per pupil cost in the report.
Oh,
Just
okay.
discussing.
I don't know.
Do you have any recognition and awards?
Recognition and awards?
No?
No? Okay, just kidding. Okay. All right, I'm gonna move on to privilege of the floor number 2.
I have 2 chats.
Okay, let's start in Zoom land, if that's okay with everyone here. Okay.
So I'm just checking to see who it was first.
And is it possible for the person that is in the chat to unmute themselves and speak that way?
It was Robin and Melissa.
All right, so why don't we start with Melissa Scaglarini. If you can unmute her.
Can you hear me?
I can hear you. Hello.
Hi. I just have a quick question about masks. I'm going to say it really quick and then I'm going to mute because people are coming home. So, real quick, would it be helpful if teachers knew what parents would like their children to be masked? Therefore, instead, because I do feel like for a young person, I have a 1st grader and a 5th grader, if there's this kind of real gray, I have it on, I'm supposed to have it on, my parents tell me I have it on, and then there's a few kids in class that don't have it on, it's the teacher can't tell them to have it on, and would it be helpful if teachers knew which parents would like their child to be masked? It's just a big question. I'm just curious to see if that's something that can be addressed or asked or just helpful for teachers. And that's all my question is. I can take it muted. I have to mute so you guys don't hear my whole family.
Is that a question we want to respond to?
I think you can take it under advisement.
Yeah, thank you for the question, Melissa. We will take it under advisement and talk about that. And then who was the second one?
Robin's coming.
Hello, I'm here.
Hi, Robin.
Hi. I'm a community member. My kid went through all the public schools in the SAU, and I'm just weighing in wherever I can to say that I hope you will consider a mandatory masking policy while state transmission is high and Delta is an issue, since we know that the science is rock solid on the efficacy of masking and the contagiousness of Delta, including for young children. But I'm also worried about the staff and faculty and community transmission being boosted by even asymptomatic school transmission. So I think we're about to get into a pretty bad place. We saw it spread so quickly at the university, so once you start seeing sick kids, it'll be too late. So I hope you'll consider mandatory masking across the SAU, and I know PES has been at the front of doing a really good job from what I hear from parents. So I hope everyone will consider that. Thank you.
Is it, what was
Thank you.
Robin's last name?
DeRosa, DeRosa.
Are you Plymouth resident?
Campton resident.
Oh, so we have to be careful with that.
All right, thank you.
Yep.
All right. Is there anyone else that hasn't spoken? Yes, Natalie?
I just had a question about discussion with the New Hampshire Department of Health. Have they discussed at all, like, where they think the state is in terms of positive cases that are not being reported? Because I know the one, like, I can go to CVS and I can get a COVID test, which I have done because I want my kids to see their grandparents, and we want to make sure that because they're not vaccinated, that they're safe to do that. And then I have a friend of mine who is a teacher in another district who just recently tested positive, fully vaccinated, and her whole family did, and they found out because they got it from it's all convoluted, but either way a lot of the testing didn't get reported. So do we has there been any guidance from the state about
the situation in New Hampshire in terms of the actual real number of positive tests?
So no, they haven't spoken about at-home tests. The good thing about schools, if they report it to us, so if a child has a case and then they report that, you know, mom and dad and the whole family, we report that to the Department of Health. The Department of Health does contact a positive individual. So whether or not it's an at-home test or not, they take our word for it that we have to report that. And so it's better that we're in school because we are able to contact folks and they are to report it. But if somebody just took a test at home and didn't report, I mean, there's no way. And Dr. Chan did not speak to that really.
Okay.
And I can personally attest that they do call you, because I was called 4 times. So
Yeah.
the state does call you.
As long as the original person has informed a school or...
Yeah, that's the only way I would know. Yep. Amy? I think you have.
I just wanted to offer 2 clarifying points and ask 2 questions, if that's okay. I first want to acknowledge that letter that was written by our medical personnel at Spear Hospital. I'm not entirely sure how to interpret that letter, whether or not that was meant to, I understand that it's meant to show solidarity with the SAU and with the board in trusting the guidelines of DHHS and making decisions based on our particular community situation. But I've been reading the DHHS guide. It looks like my bedtime reading these days is looking over these things. And it's pretty clear to me that requiring masks is absolutely something that the New Hampshire DHHS allows. And there are 4 criteria that they offer for consideration, one of which is level of New Hampshire community transmission, one of which is number of COVID cases occurring within your school or child care facility, one of which is about ability to implement other prevention strategies, and they give a 6-foot rule as an example, which we've already determined is not necessarily something we can follow at this point at PES. And the last is about COVID vaccination rates, which we know are low in Plymouth and seem to be particularly low if we can trust that for, I don't know, 12 to 19-year-olds. So I fully agree with Dr. Edner and the other doctor whose name I didn't catch from Spear that we should be following DHHS guidelines, but I'm reading DHHS guidelines and seeing they absolutely are in line with us considering requiring a mask mandate. The other point of clarification I wanted to make was about the SAS testing, because I think there's confusion about exactly what this is for. This is testing for asymptomatic individuals who've chosen to be tested. So the question about students feeling picked on or pointed out, I mean, that's a decision that they would make with their parents about whether or not they would be tested. The recommendation is that these individuals be tested once a month, and generally what they recommend is doing 25% of that cohort a week. It can be PCR tests or it can be antigen testing. It doesn't have to be one or the other, and they absolutely get the results, because if they get an antigen test and it's positive, under the SASS program guidelines, they are told to go then and get a PCR test. So this is not just about pool testing or surveillance testing to see if COVID is present. This is about offering parents a tool, just one small tool, to offer peace of mind once a month that their students are being tested. And it's a way to offer peace of mind for our school. The 2 points of questions that I just want to bring up, one of which is about this change in guidelines within our SAU from 6 feet for masking to 3 feet for masking. That is the change in the guideline. It is not a change in distance for how far away people should be. We went from requiring people a week ago to having to wear a mask when they are within 6 feet of each other to shortening that to 3 feet of each other. That is less protection than we were offering a week ago. And we are doing that as cases in Plymouth are back to where they were last spring. So I don't feel like we've addressed or heard addressed why that change has been made and how that makes sense. I keep hearing, well, this is in line with the DHHS guidelines. I see nothing. I see no guidelines here that help me understand that. And finally, I want to say, we keep saying, well, we're not seeing clusters or spread in our schools, and we didn't see it last year. Do you know what we had last year? Universal masking. That's what we had last year.
Thank you. Steph?
So just 2 points that I would want to say with the testing. Well, we might not have a large percent of people opt into it, It's the percentage that comes back positive, right? So if it's just one person that's positive out of 15, that means that there's probably not as much spread. But if you come back with these 15 people that opted in and they're testing positive, then you know you have a really big problem. Okay, so it's about the percent that test back positive. And I think that's a really important point on the voluntariness of testing and offering that to families. And then secondly, I would just say on the issue of DHS guidelines, is Chan's kids wearing masks? They are. He says his kids and himself will absolutely be wearing masks inside and in school, right? His own kids.
Thank you.
His own kids.
Thank you.
Can I say something not about COVID?
Please.
I know it's much for a second time, it's kind of odd. So and I don't even know if I'm allowed to do this because it's like a shout out to a teacher person, but I want to say that while yes, we are offering criticism about a lot of things, everybody in this room loves our school, but I really wanted to give a shout out to Nurse Sandy because she's amazing and she does so many great things. My daughter especially really likes Nurse Sandy, and not just for her Band-Aids, which are required. She brings her own Band-Aids to school. But it's just such an amazing resource for our kids to have such a wonderful person who is available to them, who can touch physical and an emotional need. We're amazingly lucky with all of our teachers, but Nurse Sandy is someone who can touch everyone. And so I just wanted to give a little shout out to her.
Thank you.
Thank you.
All right. Okay.
Is there anybody
Is there a
else?
motion to?
Hold on a second.
Okay.
Thomas, do you want to try to unmute and speak?
You can try to. No?
No.
I don't think it's about the mute, I think it's about the microphone.
Yeah.
It's about.
So you can read it real quick.
All right.
Yeah.
Fewer children from COVID than the flu, CDC Gov. Why such hysteria now? Should say fewer children die from COVID than from the flu. Less people die in 2020 when the increase from suicides and ODs are removed than in 2019. Is it possible that this is all hysteria? Thank you, and especially thank you to Kyla, who has to deal with the most with me.
All right. Thank you. Yes, Holly.
Very short.
Yeah.
Everything, I'm right on board with what folks have shared. I support a full mask mandate. And we ask our students to come in here every day and trust the professionals. You are all professionals, and we trust you. And I just am imploring you to please trust the professionals who are telling us that masks are effective and that a mandate would help. Set that example, please. Continue to set that example.
Thank you.
Thank you.
All right. Going to make a motion to go into non-public.
So moved.
All in favor of going into non-public? Aye.
Aye.
Aye.